All
Sounds
right,
good.
so we're back again, and I'm not sure if I'm going to start calling these little chats a fly on the wall, because wouldn't you like to be a fly on the wall in some great conversations of history? Maybe Dr. Chung and I are not the greatest in history, but I want to introduce you to a colleague, a friend, an amazing guy that I really appreciate his work up in West Palm Beach area. He's going to introduce himself. He's got a very specialized view and training in chiropractic and teaches quite extensively in upper cervical chiropractic. And also he's gone into the neurology world, the clinical neuroscience world. And so he's also attained recently his diplomate status in that, or status. We can still be friends, whatever you want to call it, status. But he's a wonderful guy, and we're going to share some really fun things. I want him to introduce a little bit about his practice and himself. Dr. Chung, here we go. Tell us.
Thanks, Dr. Mike. So yeah, I'm an upper cervical chiropractor originally by training. I was doing upper cervical chiropractic for a long time as like the only thing that I was doing in my practice, and we were getting really good outcomes for a lot of the common things that we see in chiropractic offices, especially with the musculoskeletal pain, migraine headaches, things like that. But in the midway of my career, I started to see a lot of patients with post-concussion syndrome, and a lot of these patients did really well with upper cervical chiropractic, but I wanted to know more about concussions as a whole, because it's more than just working on the neck. The neck can play a huge role, but there are visual issues, there's vestibular issues, there's mental health issues, and the neck is all a part of that. And I wanted to be able to give this patient population a very comprehensive care program, so that I knew that I was doing more things that could help them get back into a normal life, because they had so few options, especially during that time when most people were doing for concussions was just, hey, just wait around and rest, and then eventually the symptoms will go away. And we know now, like for the most part, there are like a huge population of concussion patients where that is just not true at all.
That's right. That's right. Very well said. So in your practice, and when we talk about upper cervical, for those who don't know, we're talking about in the upper neck area here, and its influences really strongly on the brain stem mechanisms up there. And so it's really I would say even a stronger component of a neurologically based chiropractic view. And I heard it said many years ago that, perhaps if chiropractors back in the 20s or 30s would have started speaking more about the nervous system more than the structural system, people would have thought differently about us, right? Because that's how we affect people, is through the nervous system.
Yeah, absolutely. And I came into chiropractic with the idea that like, hey, this is all about the brain and the nervous system. Really? So it was kind of surprising to me when I went into chiropractic school and then like everything was so musculoskeletal oriented, because my understanding of chiropractic is, hey, this is about the functionality of your entire body, not just the spine itself. So I had a little bit of a different upbringing into chiropractic than most people, but that was through the lens through which I saw people. And that's why I kind of gravitated towards the upper cervical and the influence of the neck on the brainstem. And that's what really drew me towards being a chiropractor, because for me, like, obviously people with back pain and neck pain, they need good care, but that was never my passion. My passion is always to be able to help a lot of people that were struggling to find answers through traditional medical paradigms.
Very good. So people can follow you, and I want to say it now, at your Instagram tag is what?
So my Instagram tag is at Keystone Neuro, and that's where you'll find most of the Instagram content that I make. I like creating little graphics and videos that explain complex neurological concepts and hopefully make it a little bit easier for people to understand. So that's where people can find me there.
Yeah, Keystone Neurologic, right? So, I mean, very good graphics too. We really love those. So you see a very diverse group of population in your practice, and so do I, like you were just mentioning, not only the concussion or post-concussion syndrome, but many different things, migraines, people with complicating in multiple factors, from mental health issues, anxiety and depression, to balance issues. We had someone here with a vestibular imbalance, an elderly gal. So there's many different types of things we have, but we're going to talk today, which I think is just the most fun thing. We are neuro nerds. Didn't you do a neuro nerd thing the other night?
Yeah, Clubhouse. So we're
good.
kind of playing around with this new social media stuff. So we're trying to be out there as much as possible. Yeah, I'd love to have you on the next one.
Yeah, we'll have to do that. Neuro nerds. I love it. So I never thought I would be able to be called a nerd. So I actually think it's like a badge of honor. I'm a neuro nerd, meaning I love the nervous system.
It's trendy to be a nerd now.
Yeah, I love it. Yeah, maybe a pseudo nerd. My kids know the truth. My wife. This is a research article. I think that you already know it, but dual task training. So this is walking and chewing gum, right? People say, oh, can you
Yeah.
walk and chew gum at the same time? It's an adage. We've heard it a million times, or no, maybe it's a metaphor. Whatever it is, it's a funny thing because can you do two things at once? Rub your tummy, pat your head, and so on and so forth. But dual tasking is something that is used in neurology to evaluate people, but it's also used in clinical neuroscience with Dr. Chung and myself and many of our colleagues to improve cognitive and physical performances. Wow. So I'm going to read a statement and we're going to have Dr. Chung just kind of explain it to us and share, because he's recently gone through some additional training up at the University of Cincinnati in eye-brain connections and dual tasking. So I'll let him tell you about that because there's some great videos that he posted about that. So this study investigated the effects of 12 weeks, right? 3 months of dual task training on cognitive status. So think about your elderly parents. Think about people that are seeming to have some cognitive decline. It measured cognitive status, physical performance, strength, and so forth, and brain oscillation, like in neurofeedback measurements that we take, brain mapping, with Alzheimer's disease patients. So these are people that already have a problem. So this is the group. Now, tell us a little bit, just quick, before I mention anything else here, that you went and did this training, which I saw a lot of dual tasking. So tell me a little bit about your experience and how you apply it in your office.
Sure thing. So Dr. Joseph Clark, he's a professor of neurology at the University of Cincinnati. He works with the athletic department at the University of Cincinnati. So he's working with the baseball players, the football players, their entire athletic department. And he obviously does a lot with concussion rehab, but his main goal is to make sure that people don't have concussions to begin with. And a big part of that is through this paradigm called neurovisual training. And what neurovisual training is, you're basically using your eyes and improving the sense of your visual discipline and visual eye movements, and combining that with stuff that's sports specific. So it could be hand-eye coordination, it could be hand-foot coordination. And also you're combining that with the idea that when people play sports, you're not just moving your body in order to accomplish a goal. Like, you're tackling someone, but in the process of tackling someone, you are listening for snap counts. You are looking for, what's the running back doing in a backfield that might be changing the play that you originally called. You have all this stuff that's going on in your head, and these are cognitive processes, right? But we so often discount the cognitive part when people are athletic. We think that, oh, these guys are just physical specimens, and as long as they have this superior athletic ability, then they're going to beat everyone that's in front of them. And in some ways that's true, but in other ways, the cognitive aspect is how people could get a little bit of an edge on their competition. So what Dr. Clark does is he combines the visual aspect of the nervous system training with the hand-eye coordination aspects and the cognitive aspects, which means that you have to look at something, make a decision of what to do with your hands and feet, and also you have a cognitive task in front of it. So, you gave a great example before where you were talking about like walking while chewing gum, or doing that thing where you pat your head and then you rub your tummy in a circle. And these are, like, on the basic level, dual tasks, because you're trying to do two separate things at once. And I know you use it a lot in your therapies, where we're having people do multiple tasks at one time. And the big part with clinical neuroscience is the eye movements are powerful inputs into the brain. So we could use these eye-hand coordination exercises as a really powerful stimulus and combine them with a cognitive drill. And when you do that, it just increases this rate of plasticity that happens, and it also keeps someone like an athlete super engaged, because they don't want to just sit there and just like tap a button. They want to feel like they're being challenged, or they have a score to beat, or they have something that's driving them to get to the next level of their performance.
I love it. I love it. And so with our diverse populations, I have a chart. I can see it out the door here that I was just working with an elderly gal, as I was saying, in her late 70s, who had a vestibular issue and balance, and anyway, complex situation. But we have on that piece of paper A, B, C, D, E, F, G, H, I, J. And so we have the letters of the alphabet. And we have her as she's walking, and it's a very low level task, but she's having to read through the alphabet, then stop, then go backwards and read through the alphabet, and then stop the next line, the next line. So it's a version of doing two things at one time. She's having to read the alphabet, walk forward, and then walk backward, walk forward and walk backward. And we've done that with some, and she's getting eye movements, right? She's having to read
Yeah.
across. And we have little numbers next to them so we can say, go to the numbers, go to the letters. And so we can change it up for her. And I even did this for a neuro nerd. You'll tell me if this is good. So I do my runs once a week. I go over to the park and I run like 160 miles, 160 miles, 160 meters. I'm a former track athlete, but my cognition is going down. 160 meters, I do like kind of like a 50 to 60, 70% run. And I start doing like a trails, 1A, 2B, 3C, 4D while I'm running. And it becomes increasingly difficult as I do it. But I notice that the first few times I do it, my run times are better.
Oh, that's interesting.
Isn't it? So if I do it with just running, my times are, they're pretty stable. I do them the first few times with that and my times improve. I'm like not even thinking about my body. And then eventually I hit fatigue level and I can't do the cognition and run slow down. But it's an interesting observation. That's all it is.
Well, I think it's one of the things that we'll also see when we're evaluating patients, right? So
Yes.
when we have a patient where we have them just walk and we have them say the months of the year backwards, where
Yes.
most patients, they're going to slow down a little bit, which is not a terribly abnormal response. But then you have some other patients where their walk and their gait actually improves when you actually incorporate dual tasking, which is,
Right.
ooh, we could use this to get them better really quickly. And the people that it's slowing down, then maybe we take a bottom-up approach with those patients and then get them up to the point where they could do dual tasking and they could do it competently and then efficiently from there.
Wow, that's brilliant. I mean, the way you said that, it just went by so fast. So let's reiterate that. So we would maybe have people repeat the months of the year in reverse order or skip a month. And if it slows down their gait, maybe we want to do a different approach. But actually, some people's gait gets better. So maybe we want to use that as a strategy for them to help them. Wow.
And that just gives us an insight. It's like, all right, their frontal lobe is pretty well intact. So if their frontal lobe's intact, maybe we could use the frontal lobe so that we can improve some of the efficiency of some of the other systems, right?
You just gave people a window into how clinical neuroscience works. Is like, see what's working, see what's not working, and try to understand how to configure an approach, a therapy, an activity that improves function in that area, but doesn't exceed their level of metabolic capacity. I know it's fancy words. So I want people out there to do a gait test for yourself. Walk forward in a surface where you won't trip and see if you can do say the months of the year and see what it does for your gait. Say the months of the year in reverse order or say them skipping a month starting with January. We'll just throw that out there and see if they can do that. All right, last sentence here, Doc, from this research article. In addition to physical performance, the regular combined training with visual stimulation improves brain health. So it improves brain health as indicated by improved cognitive function and reduced theta alpha ratios. But what does Dr. Clark say? Brain training is eye training is brain training, right?
100%. 100%.
So use a lot of eye training activities in your practice?
I do now, especially since I've come back from the seminar, because it gives us such easy ways where you can work muscles that have a big input into the brain. And certainly for our concussion patients, ocular motor rehabilitation is a big part of what we do. So we look at, can they do, a saccadic eye move? Can they move their eyes fast? Can they have problems moving their eyes slow? And then we figure out what they could do well. And then we stack that onto some cognitive challenges. So maybe we take a patient and, they progress to the point where they could do eye movements competently. But then after we see that they could do eye movements, cognitive tasks. So let's have them, list off all their favorite sports teams that have a bird in their name, or let's have them list all their favorite car types and have them do the cognitive tasks with the eye movement training and see if they could still maintain some of their speed and integrity.
I love it. And you turned me on to vision sticks, which I started to use with Franco Lococo there, the vision sticks, and utilizing those. We use those quite often in the practice. We'll talk more about those another time. But look, you got to connect with Dr. Chung on social media. I mean, the work that he's doing is brilliant up there in West Palm Beach, and people travel to him from different places. So best to you, brother. I appreciate your time today. We have to do another one.
Yeah, absolutely. Anytime. Thank you so much, Dr. Mike.
Fly on the wall chats with Dr. Chung. Great time. Thanks, Doc.